Yeah, get ready, folks. It probably is not going to feel like flu season yet, but it is upon us. It's here. And health officials say this year's strain could pack quite a punch. The CDC is urging everyone 6 months and older to get vaccinated. Wash your hands often and stay home if you feel sick. It adds that the flu vaccination lowers the risk of hospitalization by up to 52% and can cut severe complications, especially among seniors and young children. During an average flu season here in the United States, between 9 and 41 million people get sick, leading to hundreds of thousands of hospitalizations. That's unfortunate, folks. So you got to get vaccinated. Right here to help us out, to help defend from the flu bugs, is Dr. Felipe Lobelo. He's the associate professor at Emory School of Public Health. Welcome to the show.
Thanks for having me.
Yeah, not a problem, not a problem. We hear about flu season every year. What's the difference, or what's different this year, or what's most concerning about this strand that's coming out?
Well, the last season was particularly severe. We've seen, unfortunately, a lot of pediatric deaths. Probably the most severe flu season we've seen in the last 10 years. And we know the virus changes every season, and that's why our vaccines have to be updated. So it's critical that everyone gets vaccinated against the flu early in the season, September, October. You don't want to wait, and you want to be protected as soon as possible.
Got it. You hear about this every year. We tell people, hey, get the flu shot. Make sure you get the flu shot. I know it's essential to some, like healthcare workers and maybe some schools, you have to get it. But there are people out there that skip doing it. Why do you think that's the case? And what's the best way to convince those who may be on the fence or say, hey, I never got sick or I never got the flu?
Absolutely. And it's understandable that people may have questions about vaccines and in general flu vaccine. It's important to know that the flu vaccine is not perfect, but it's the best thing we have to protect us individually from severe disease. So a lot of people unfortunately get sick and end up in a hospital or have to take off time from work. You also want to be able to protect those around you. You may be healthy, but there may be people around you, babies, older adults, pregnant moms, that need that protection. So there's a lot of reasons for our personal health and for the health of others around us that really tells us that it's important that we take advantage of having excellent vaccines.
Yeah, full disclosure here, I have been one of those that have heard people say, hey, they're actually giving you the flu. So sometimes I skip, sometimes I get it, that kind of thing. Tell me about what's the biggest thing that people get wrong about this thing?
Thanks for that. And that's a common one, right?
Mm-hmm.
The flu vaccine cannot give you the flu because it's an inactivated virus. It may give you a couple of symptoms, early symptoms that are very manageable, like you have pain in your arm, or maybe get a little sniffles or things like that. But it cannot give you the virus. It's just showing your immune system what the virus looks like. So when it comes down to you getting infected later on, you can fight it better. And the other misconception is that it doesn't work. And the truth of the matter is that 90% of kids that unfortunately are hospitalized and die were unvaccinated. So it's the best protection that we have. It's not perfect. The flu changes every year, and the flu vaccine also has to be adapted. We sort of try to have the best match possible, but it's absolutely an essential way to keep us all protected. And that's why doctors like me take it every year, because we are not only protecting ourselves, but our families, our patients.
So that, along with the washing of hands and some of the other tips you give, are all really the best possible ways to protect yourself from this thing.
Correct.
Yeah.
We've learned during the pandemic and COVID that these viruses really transmit by us touching things that other people have touched. So washing your hands every day, repeatedly, if you've been around in congregate settings, is important. Obviously, if you're sick, if you have symptoms, stay at home. You don't want to propagate the virus. You don't want to get other people infected. And this is particularly true for kids. So stay at home, keep your kids at home, because you don't want outbreaks going on during the school season, because it's going to affect everyone.
Yeah, and it's not just the flu, right? In recent years, we've seen overlapping outbreaks of flu, RSV, and also COVID-19. How do families protect themselves from all three?
Absolutely. And all three viruses are circulating in Atlanta and in Georgia. We already are, of course, in the respiratory virus season. And the symptoms are very similar between those three viruses, right? So really the only way to tell is by going to a doctor and getting a test, or if you have a test at home. the most important thing about flu is vaccination. The most important thing about COVID is vaccination. And the most important thing about RSV is vaccination. They all have excellent vaccines that are available, and particularly for small babies, pregnant moms, and also people over 65. These vaccines are critical in keeping us from having severe disease in these groups.
All right, Doc, I got to go back to the doubters now. This is not me this time, but I have heard people say that, well, I got the vaccine and I still got sick. I'm not doing it anymore. What do you say to them?
It may be true. So it may be because you got the vaccine, and really it takes a couple of weeks for the vaccine to work, for your immune system to rev up, and in order for you to be protected. So maybe you got the vaccine, and unfortunately you got in contact with the flu virus within that 2-week period. Or it may be that you didn't get as sick as you would have been if you didn't get the vaccine. And we see that often. Someone that has a pre-existing condition like diabetes or COPD or heart disease really can get hit really hard by flu. So you want to be protected. So even if you get infected, you're not going to get as sick. You're not going to be having complications or end up in the hospital or the ER.
Are there two different types? Is there a high, I thought I heard earlier that there's a regular vaccine and then there's a high dose or something like that? What's the difference between those two?
Correct. For certain groups, like people over 65, we have a high dose vaccine that essentially gives you a more potent vaccine, because again, we know that these are the group of people that can get really sick with the flu. We also have a new version of the vaccine that is a flu mist that you can take at home. Parents can also give it to their child, and it's a more convenient way. If you don't like those jobs or like going to the pharmacy, you can order and get it at home, and you sort of like spray it in the nose. So we now have more and more options to protect ourselves against the virus, and it's really a preventable, vaccine preventable disease, right? So we should really take advantage of the technology, of the availability, and protect ourselves and our families this season.
All right. Doc, really appreciate all that insight, man. Some good stuff there. Really appreciate it. A lot of folks probably like me on the fence at times. You may have saved them right there. Thank you, sir.
Appreciate it.
All right.
Thank you for your question.
Take care.